Thanks to everyone for joining us. I'm Eve Gartner, the Director of Cross-Cutting Toxic Strategies at Earth Justice. We have a great program for you today. To start off, we'll be hearing from Jay Campbell and Rebecca Nasser, who are both partners at Hart Research. They will share with us the key results from their recent polling on motivating public action on toxic chemicals. But before turning it over to them, I wanted to share a bit of context for this polling. It was done on behalf of an alliance of 9 groups and coalitions who developed a joint pilot communications project called Take Down Toxics. The idea for this effort was to explore the potential impact of multiple organizations and coalitions rapidly deploying tested communications at high volume in a coordinated way using a range of tools, traditional media, social media, and newer approaches such as influencers. After I finish speaking, I'll add the 9 groups who are involved into the chat. So the Takedown Toxic Steering Committee retained Hart Research to do polling to help us simplify and refine our messages to reach the broadest possible audiences. So we were looking at MAHA-aligned audiences, but definitely not limited to that. We also wanted to understand how to reach disaffected audiences and just more conservative audiences broadly, as well as, of course, our base. And we believe that the investments in this polling and working with influencers shows promise and have brought fresh perspectives to our issues and helped us reach broader audiences. There's obviously a lot more to understand and do on this front, and we are exploring additional collaborations with similar goals, building on what we've learned. We're very grateful to the Broadreach Foundation for its generous support of this pilot effort. After the polling presentation, a few folks from the Takedown Toxic Steering Committee will offer some of their thinking, and then we will open it up for your questions. And with that, I will turn it over to Jay and Rebecca.
Thank you so much, Eve. Thank you, everybody, for joining and being on with us. Rebecca and I are very excited to talk to you about this important research we did with the Takedown Toxics Coalition. What we learned from it, what we take away from it, and to get any questions you have afterward or during, as said at the outset by Margaret, if you put your questions into the Q&A function, we will answer as many of them as we are able to do. Okay, so what we did in this poll, we interviewed online about 1,800 registered voters nationally. They were taken from an online market research panel, but matched back to the voter files. So we know, in fact, that all these people are real people and they're all registered to vote in their various states. We conducted this survey at the very beginning of the year and have every reason to believe that everything we have in here holds now 4 months later and continues to be the case. And the sample is representative of registered voters nationally. We weighted it to make sure that it is so. We learned a lot in this survey, and we've had to cull it down to what we think are the most important findings. Otherwise, we would have had to keep you here all day. But one important contextual point to start off with, and this in some ways undergirds everything we're going to be talking about, is we are in an opinion environment in this country right now where people are definitely not happy with corporations. At a very high level, I'm starting on the left side of this particular slide, when we just ask, generally speaking, whether you have positive or negative feelings toward corporations, generally. No modifiers there. We don't specify types of corporations. Already by 2 to 1, people feel more negative than positive, 41% to 20%. When we do start putting some modifiers on, especially modifiers that are relevant to this project, you can see chemical companies and plastics manufacturers, the positive feelings, the blue bar gets lower, the gold bar of negative feelings gets bigger. People feel even worse and have more unfavorable opinions toward chemical and plastic manufacturers than they do corporations generally. And underneath or above, depending on how you want to think of it, all of those are corporate CEOs. Again, we don't talk about specific companies or industries, just corporate CEOs in general have a very negative profile right now, 54% negative, only 12% have positive feelings, which is all to say that companies in general, corporate America in general, and plastic and chemical manufacturers specifically don't have a particularly strong base within the American public for how people feel about them. This extends to how people want government to interact with business at this moment in time. We posed these two statements and asked people which they agreed with more. By a margin of 60% to 40%, people say that they believe that there's not enough oversight and standards of businesses to keep people safe from their products versus worrying more over overregulation of businesses. Um, this is all to say that at the moment, that takedown toxics is sort of ramping itself up. It's a good time to be trying to hold corporate America accountable, including through government regulation. When we tried to place the issue in context, there are a couple important things to note on this slide here. We listed these various things out for our survey respondents and asked them how much of a problem each one is. They could say anywhere from a very big problem to not a problem at all. We're just showing the percentage to say very or pretty big problem here. Unsurprisingly, and I know I'm not shocking anybody with this, inflation and the cost of living stands over every other issue we asked about by a substantial margin to the degree to which people think it's a problem. And, harmful chemicals in our food kind of comes in the middle of this list. This is obviously not an exhaustive list. There could be any number of issues on it. But for this list, harmful chemicals in food, 63% say it's a very or a pretty big problem. So that puts it obviously well below inflation and the cost of living. Again, not a surprise. Puts it fairly substantially beneath federal spending, puts it pretty significantly beneath crime. But having said that, something doesn't have to be the most important issue for people to view it as a problem. And in fact, almost 2 out of 3 voters say that harmful chemicals in food are a problem. The split between very and pretty big is an important one. A little more than a third say it's a very big problem. In an ideal world, you want to see the intensity of feeling to bigger and stronger than that, but it's a good base on which to sort of build a campaign. The other couple of things to note is the difference between harmful chemicals in food and harmful chemicals in household products. The latter drops down a few more points. Still a small majority say it's a big problem, but the percentage who say very big problem has gotten even smaller, now down closer to kind of 1 in 4. The final thing I'll say here is it was interesting to me as someone who has been working on climate change and attitudes towards climate change for many years now, of which air and water pollution, air pollution in particular, is a big part of that issue. To see harmful chemicals in food actually edging out air pollution even as a significant problem in people's minds, I think speaks to how this is a good time to be kind of raising the issues that deal with harmful chemicals in food for people. We asked a similar question about problem, only went a little bit broader here, and that's an important point. We asked how big of a problem do you think exposure to harmful chemicals, pesticides, and plastics is today in the United States as a whole? First, 56% say very or pretty big problem. Now you're going to say, wait a minute, Jay, a moment ago you told me that 63% said chemicals in food are a problem. That is true. And it underscores why the specificity of food is so important here. It really does seem to be a touchstone for people when talking about chemicals, to bring it around to the things we are using to get our nutrition that we're putting into our bodies. And these 56% where we just sort of ask about harmful chemicals, pesticides, and plastics in general is really closer to the household products numbers I showed you a moment ago. So it's good. A solid majority see this as a problem in the United States today. Again, only about 1 in 4 say it's a very big problem. But the bigger issue is when you bring it down to the level of people's own communities. When you ask about the degree to which this is a problem in the area where you live, you're down a solid 25 points. Only 31% now say that this is a very or pretty big problem. The very big problem has cut by half to just 11%. Almost as many people say it's really not a problem, much or at all in their area. And this is one of our biggest takeaways, and probably the most important takeaway from this research is that this issue of harmful chemicals has to be localized. It's fine to say something is a problem nationally and to want something done about it, but we know from many, many years of doing this that the more personal and closer to themselves people see a problem as being, the more apt they are to demand action on that. This huge drop off is a little bit problematic because it's something that needs to be built up, and the case needs to be made for people that yes, in fact, harmful chemicals, plastics, and pesticides are a problem in the area and where you live. That's what's going to create action. The sort of interesting thing is when you personalize it even further and say, how much do you personally worry about your or your family's exposure to chemicals, et cetera? The numbers are actually a little bit higher than for the community in the area where I live in general, which I don't have a specific explanation for, though I do think it's interesting because it's counter to what you would expect. Here, 39 and 38% respectively say that the food you eat or the water you drink is something that they worry a lot or a fair amount about, and chemicals being in those. Again, food really does lead the way here in a very important way. It drops off a little bit for the air you breathe. It drops off quite a bit more for food packaging and for household products. The other one thing I wanted to point out here is talking about food can be done in different ways. And we did a little split sample experiment where half of the respondents were asked about their worry for the food they eat. The other half were asked about worry for the fruits and vegetables that they eat. You can see from the jump that the worry about the non-specific food you eat, the general category, is of several points higher, meaningfully higher in the worry a lot category, 18% versus 11%. I think that there is a positive sheen, if you will, on fruits and vegetables, that the healthfulness of fruit and vegetables helps inoculate them a little bit from worry, even though we do specifically ask about pesticides and people don't like pesticides. From a messaging standpoint, you're on stronger ground speaking more generally rather than talking about fruits and vegetables specifically. That takes us to the various actors in this particular debate. We listed out for people, this was not an open-ended question. We listed these six groups and said how much responsibility or who has the most responsibility to keep people safe from harmful chemicals. First, on the bars, the top answer people give is the federal government. 32% chose that as the most responsible in their mind. The next two answers, about on par with one another, are back in the corporate realm. The companies that make the products from chemicals and the companies that make the chemicals, plastics, and pesticides themselves. Interestingly, that the companies that make products from the chemicals draw a little bit more blame or responsibility here than do the manufacturers of the chemicals themselves. But the other point to note, and we didn't cut it out this way, but you should know, you combine those, you have 48% who say it's corporate America that has the responsibility here. My first choice is one of these two elements of corporate America. That makes them even higher than the federal government. And it really makes them higher, as is the federal government higher, than individual people. We do a lot of polling where personal responsibility kind of drives people's thinking. Even in the public health realm, we've done work on the opioid crisis. We've done work on obesity and exercise. Many people's gut reaction is it's up to the individual to take care of yourself. That is not the case here. Only 15% choose individuals' responsibility to avoid these products themselves as the most responsible party. And even when you give them the choice to choose the three most responsible out of this list of six, fewer than half of the public choose individuals. And at that point, the numbers who choose the federal government or companies get even higher, upwards of 70%. The final note is not all levels of government are created equal here. State and local government are way down this list in general, and especially relative to the federal government. by and large, and we found this in other questions we asked in this poll too, people are more apt to see the federal government as the primary level of responsibility within government here. It's just it's they're far less likely to say that state or local, and even less likely to say the local government should have the main level of responsibility. Um, so how do they think that these different actors who have responsibility are doing? The answer is very badly. How good or bad a job are chemical companies doing protecting people? It's by 64% to 27%. People say that chemical companies are doing a bad job. Mostly say a somewhat bad job, but 1 out of 4 say a very bad job. Only about a quarter say they're doing a good job. And miraculously, we have found the issue that brings together our different partisans within the public. There is virtually or very little difference anyway between Democrats and Republicans on corporations saying corporations are doing a bad job. Democrats are a little bit higher at 69%, but a very large number of Republicans, 60%, say that they're doing a bad job, as do 62% of independents. On the government, not the federal government specifically, but just government generally doing a good or bad job. Again, it's about a 2-to-1 ratio of bad versus good. The good gets up a little bit higher, but really not very much. The reason the good gets up a little bit higher is Republicans are a little less apt to say that government is doing a bad job on protecting people from chemicals than Democrats are. It's important to keep in mind, even though we didn't ask about the federal government, people do tend to think very much about the federal government when you say this. And who is in leading the federal government, who has full control of the federal government right now? It's the Republican Party. So Republicans are going to feel nominally better on almost any topic about the government. Having said that, still a majority of Republicans say that the government's doing a bad job. And then one final slide before I turn it over to Rebecca on this government point. When we do specifically ask about the federal government, we asked it slightly differently. Do you think the federal government's doing too much, too little, or about the right amount to protect people from harmful chemicals? Fully 67% say the government's doing too little. And we're not showing it here. By the way, there's not much difference between Democrats and Republicans on this. They both say the federal government is doing too little. The big caveat about the government is people don't know what they don't know. And we asked this question, and Rebecca and I have done other work on public health issues where we asked a similar question that we said, maybe we should ask it here too. Do you think the federal government tests chemicals, pesticides, and plastics before they can be used in household products to ensure they're safe? A majority are inclined to think that this testing happens for every single chemical that's deployed out there. They're not certain about it. You know, a lot of people say, I think they probably do test them. But if you push people, by and large, people assume that these are being tested. Only 27% are disinclined to think that chemicals are tested, and about 1 out of 6 people admit that they don't really know. But in a public education campaign, you got to let people know that, especially in this case, given what I showed you, that the actor they see as being most responsible is actually not really doing what they think they're doing. And they already think they're doing a bad job. So really, there's a pretty good case to be made that you can drive down those numbers a little bit further and create even more desire for action with a basic amount of public education on what the government really does in this realm. Okay, Rebecca, I'm going to pass it over to you, please.
Great. Thank you, Jay. So I'm going to turn now to some specific policies, and then I'm going to talk a little bit about effective communication to really make the case for public engagement to take down toxic chemicals. But so to begin with, we shared a brief description of the administration's proposals to weaken oversight and protect chemical companies. So this was an online survey, as Jay said, so we had the luxury of giving respondents a little more detail as they read it. So respondents were given the information that you see on the left side of the screen here. One important caveat, we did not brand this as the Trump administration. We simply said that the EPA and the FDA are planning to change the rules that guide the federal government in its oversight. And we gave them these 4 planks: reducing government oversight of companies that make chemicals, preventing states from making their own laws to regulate chemicals, plastics, and pesticides, protecting chemical companies from lawsuits, and limiting the federal government's review and approval process for new chemicals to allow them to essentially expedite that process and get them to market more quickly. And what you see on the right side of the slide here is that by greater than 2-to-1, voters think that these policies or these shifts in policy are a bad idea. That's a 34-point differential there. 64% say it's a bad idea. I want to point you to the dark gold section of the bar there. Half of all voters tell us that they think it's a very bad idea. This is the majority point of view across the political spectrum. 72% of Democrats tell us they think it's a bad idea, 57% of independents, and 58% of Republicans. So in terms of the campaign and fighting against proactive initiatives that this administration or any other administration or the Republican Congress might put forward, the electorate is in our corner and firmly believes that this kind of weakening of the current protections that exist is not good public policy and not a good approach. We go to the next slide. On the flip side of that, we also tested a series of policies that could be implemented to put greater protections in place for the American people against harmful chemicals. And what we're showing you here, we tested 9 different policy ideas. And the first key takeaway here is that there's really solid support for a wide range of policies that would create greater protections for American people and their American families. Majorities of voters support or think that the following things definitely should be done, as you can see from the dark blue bars on this slide. We do, as Jay said, a lot of this kind of research, and it is really rare to see this kind of overwhelming support for such a range of different policy ideas. So I'm not going to read through all of these. I know that everyone on the webinar can read, but some of the sort of things that garner the greatest support: requiring companies to disclose the chemicals that are used in their products, requiring companies to pay damages when chemicals that they make cause harm, require all chemicals to go through the full review rather than an expedited or a fast track review. As you saw previously on the last slide, that is something that voters think is a bad idea. And here we see that a proactive policy to require that a thorough review is conducted, 73% of voters think that that is something that should definitely occur or definitely be current law. So majorities support all of these protective policy proposals. And then when you add the proportion that say that this probably should happen or this should probably be done, the percentages are overwhelmingly high. If you look at this across the political spectrum or the ideological spectrum, support for these things is extremely strong. When we talk about those dark blue bars, majorities across the spectrum support these. So there is a very broad and very deep public support for a proactive policy agenda that protects American families from toxic chemicals and puts greater enforcement on the companies that make those chemicals or make products with those chemicals. So if we turn now, shifting gears, we want to talk about how to effectively make the case to motivate the public to engage in the fight. One of the primary objectives of the research was this mission to figure out how we make the case that the public needs to engage in a fight to curb toxic chemicals and put protections in place. And we learned a lot of things. One of the objectives was to identify audiences kind of beyond the base. So there's a big, broad library of research that folks have done about how you communicate with the base, people that are already sympathetic or already worry about toxic chemicals. We wanted to broaden that a little bit and see if there are other audiences that we could appeal to that could be persuaded, audiences that we would think of as persuasion audiences. So we'll talk a little bit about that as we walk through this. But the kind of big takeaway is that we've really identified kind of a way to effectively communicate that meets a really broad swath of the electorate in terms of engagement on this issue. So if we go to the next slide, the first couple slides are just really, really basic stuff on language. And what makes this easy is that there are clear winners. So the first one is what we should call these things when we're talking about them in public discourse. And the answer is we should call these toxic chemicals. We gave survey respondents these 7 different terms or words, and we said, you need to rank the 2 that you think best describe what we've been talking about in this survey. And we did this at the end of the survey, and I'll talk in a minute about the fact that we did, to make this a fair fight, we tested both messages in favor of greater restrictions or greater oversight, and we also tested opposition messages so that voters were exposed to both sides of the issue. And at the end, we said, what do we call these things? Toxic by far is the term that voters associate with these chemicals and pesticides. 48% of voters identified or selected toxics as the term that they would use to describe these things. So almost half of voters. This term is the preferred term among our base. So people that are already with us on this issue and think there needs to be greater oversight, but it's also the top term among Democrats, independents, and Republicans. So you're really speaking voters' language broadly when you refer to these things as toxic chemicals. The next slide is another sort of piece on the basic language that we should be using when we're communicating. Jay showed you this slide, a different version of this slide. It wasn't horizontal bars, but this is a basic feelings thermometer. So do you feel positive or negative towards each of these things? This is asked at the beginning of the survey, so before they are encumbered with all kinds of information and messages on both sides. And there's a couple key takeaways here. We did some what we call split form exercises where half the sample gets one term and half the sample gets another term to see if one connects at a higher rate or more strongly with the electorate. And so the first big takeaway here is that corporate CEOs are better villains than just corporations. So 54%, over half of voters tell us that they feel negative towards corporate CEOs. 1 in 5 feel very negative towards corporate CEOs. It's not that they love corporations. 41% feel negative towards corporations. But when you have a few minutes to make your case, corporate CEOs are a better target than corporations broadly. And then we did a similar exercise with some of the terminology for the chemicals themselves. So we tested pesticides, forever chemicals, and PFAS. And again, as you can see here, pesticides, and then to a slightly lower degree, forever chemicals are a much better villain than PFAS. And the sort of bottom line with the PFAS is that just a significant share of the electorate, half of the electorate, tell us that they either don't know what they are or they feel neutral towards them, which to us, we see this often in our work, signals that a big proportion of those folks don't know who they are. So in terms of your communication, when you're talking about these things, corporate CEOs are a better target and pesticides are a better target as well, or forever chemicals. We turn to the next slide now, getting into specifically to the message testing that we did. As I said, we tested both our messages that make the case for stronger protections against toxic chemicals, and then we tested a battery of opposition messages that companies or allies, their allies up on the Hill, might use in fighting back some of the policy proposals that we may put forward. And we tested 9 messages. We are not showing all 9 messages here, but the appendix to this deck has the full text of all 9 messages. The titles to each message on the left side of the slide here were not shown to survey respondents. They were just given the text. And we went at this 2 ways. We asked them to rate each message individually in terms of how convincing it is at making the case that we need stronger protections. And then we gave them the 9 messages again, and we said, now you need to rank the top three that do the best job at making the case. If we showed you the ratings of each message, the bottom line is you've got a lot of good frames, a lot of good ways to make the case. But when voters are asked to pick the top three, there is tremendous consensus. And the top three fall into three kind of broad buckets, if I may. So the first and the most convincing has to do with the effect on children. And I don't think this is a surprise to anyone. We see this in a lot of our research related to air pollution and other climate. The impact on kids has strong resonance across the board. What we're showing you on the right is the proportion of voters who, on a 0 to 10 scale, rated this message a 9 or a 10. So at the very end of that scale, 6 and 10 voters tell us that this message illustrating the negative impacts on children is highly convincing. The second broad frame or lane of messaging that's highly effective is making the case that we all have a right to know what is in the air we breathe, the water we drink, the food we put into our bodies, and the products that we use. Similar proportions rate this idea as a 9 or 10 on that 0 to 10 scale in terms of being highly, highly compelling. And then the third lane or frame has to do with the horrible health effects that these toxic chemicals have in terms of cancers, infertility, and other very negative health effects. And I'll show you in a minute. We also tested a series of proof points to reinforce these messages, and you'll see that those data related to the really awful health impacts of these toxic chemicals is very powerful and really improves our communication. But the bottom line is these three messaging lanes or messaging frames make the most compelling case. These are the most effective messaging frames really across the electorate. They perform exceedingly well with across the political spectrum. They also perform very well with both our base, but also with some of those new, more conservative targets that I talked about. So some of the MAHA-aligned audiences, really these messages, specifically health impacts, right to know, and children, really do resonate with some of those MAHA-aligned segments of the electorate as well. So if we go to the next slide, as I said, we also tested 12 data points to see what kind of factual information raises the greatest concerns among voters. And we think of these as kind of supplements to the messaging frame. So these are things that you can add to your messaging that really strengthen and reinforce your messaging. And what we found, we tested 12 data points. What we are showing you here are the 5 most effective, and they really break out into 2 different tracks or 2 different lanes of messaging data points that are highly effective. And the first focus on health impacts. And that's the first, the third, and the fifth data point or bar on this slide. And what we did is we gave them all 12, and similar to the messaging exercise, we had them rank the top 4 or 5 that they find to be the most concerning. So the 50% of all voters ranked this first data point as one of the most concerning. Since the 1990s, exposure to chemicals, plastics, and pesticides have contributed to increases of 175% in cancer, 283% in diabetes, 133% in Parkinson's disease, and 75% in dementia. So again, just really spelling out the documented negative health effects is very powerful. And then if you look 2 bars down, specifically focusing on children's health is also highly compelling and highly concerning. And then lastly, the final bar on the slide there, the effect of these toxic chemicals on the nervous system and the brain of developing children is highly compelling. And then the other lane of highly concerning or compelling data points or facts are data points that demonstrate the depth and the breadth of this problem. And Jay mentioned earlier the need to really localize and personalize the extent to which toxic chemicals are a problem in our country today. And these data points do that very effectively. The second bar on this slide, again, half of voters rated this statement as being highly concerning. At least 45% of the tap water in the United States is now contaminated with PFAS. Based on what we learned in the survey, I would change PFAS to another term. But again, highly concerning to people to understand that such a significant proportion of our drinking water is contaminated with these toxic chemicals. And then 2 bars down from that, this fact that 90% of Americans are exposed to some of the most concerning chemicals in plastics, pesticides, et cetera, is another compelling point. So again, when you have a limited time to make your case, these are the kinds of facts or data points that are the most effective at connecting with voters. If we go to the next slide, we also tested 10 opposition messages or messages that chemical companies and their allies on the Hill or in state legislatures would likely use to beat back some of the proactive policies that we will put forward. We did the same thing. We had them rate each of the messages, and we tested, I think it was 10 messages. We're showing you the 3 kind of most effective. We had them rate each one on that 0 to 10 scale, and then we had them rank the top 3. In terms of the ratings, if you recall, with our messages, the top messages, the 9 to 10 ratings were around 60% of voters, so 6 and 10. This is drastically different. None of these messages really have traction. So that first message there about legislation to put greater safeguards in place will increase the price of food. 14% of voters rated that a 9 or 10, 1-4. 12% rated a message about the fact that these products are essential to our daily life. And then 15% a message having to do with regulations will drive up costs. We know that affordability is the #1 problem facing the American people right now. So it is not surprising to us that the affordable foods and the regulations driving up costs messages are the opposition messages that tested the best. And when they were asked to rank the messages, those are 2 of the 3 that they selected. The point, these messages kind of getting lackluster reactions from voters is not an excuse for us to get caught flat-footed or to rest on our laurels. Everybody on this webinar knows that when threatened, the companies that manufacture products with these chemicals and that manufacture these chemicals themselves will use the full force of their profits to fight back. And so we should be armed with ammunition to inoculate against these criticisms or against these opposition messages. We're not showing you a slide on it, but we did do a test to test 2 of our effective messages against the affordability criticism of greater regulation on these companies. And we tested 1 message that focused on the impact on children's health, and we tested another message that kind of attacked corporations and corporate CEOs. And the message on children's health impacts does a much better job of inoculating against the affordability criticism of new protections against toxic chemicals. So that would be the best way to approach that issue. And then lastly, before we open it up to questions, I just wanted one last slide to show you is the good news at the end of the day. It's good news, but it's not good enough news in our estimation. So at the beginning of the slide, as Jay showed you, we asked how big of a problem exposure to harmful chemicals, plastics, and pesticides is in the US overall, and then again in the area where you live. And then we came around and asked that again at the end of the survey after they'd been exposed to all the information and messages and facts on both sides. And the great news is, in terms of the country overall, we see an 8-point increase in the proportion of voters that tell us that they think it's a problem. So it goes from 56% to 64%. So it's growing, and it's growing in the direction that we want to see it grow. We'd like to see it grow even more. The other piece of good news is we see that movement across party identification or across the ideological spectrum. So among Democrats, it goes from 63 to 72%, so a 9-point increase. Among independents, it goes from 51% to 64%. And among Republicans, it goes from 49% to 57% at the end of the survey. So again, solid movement in our direction across the electorate, which is very positive. On the more challenging idea here, which is that this is a problem right in your community where you live, we still see movement in the right direction, which is promising, but it is not the kind of movement that we want to see. It's a 4-point increase. It goes up to 35%, thinking it's concerning. The bright spot here is among independents. They move 14 points up that ladder to 41%, thinking that that exposure to toxic chemicals is a concern in the area, or is a problem in the area where they live. So takeaway here is that with effective messaging, we can move the electorate and we can engage the electorate, as long as we kind of stay focused on those narrow frames that we know have salience and connect with the greatest proportion of voters. So I'm going to stop there, and I will turn it back over to Eve.
Great. Thank you so much, Jay and Rebecca. That was so informative. And we are now going to hear just some brief comments and thoughts from two members of the Take Down Toxic Steering Committee that I mentioned earlier. And Judy, I'm going to turn it over to you first. Judy Robinson from the Coming Clean Alliance.
Hi, everybody. Thank you so much for that great presentation from Hart Research. I'm delayed on an airplane and now heading to my hotel, so sorry I'm in transit for this. But one of the things before I turn it over to Cindy that I wanted to say is that one of the things that really stuck out to me, having worked in this field with Coming Clean for 25 years, is that when we started, Republicans were totally in opposition to an idea that the chemical industry was doing more harm than good. And we've really stuck to a kaleidoscope of strategies with a mutual goal at the end, working together as a nonprofit, justice-based environmental health network and movement to stay the course, to take the lessons that change happens slowly. But if you're committed, if we are committed and we work in alliance, we can bring forward the information that really changes minds. And so the biggest hurdle for us 25 years ago was to convince Republicans. And this research really shows that increasingly they are with us. Democrats are also increasing their support for our issues and independence as well. So, if we've learned anything from the Koch brothers and the right side of the political aisle, it's that whether it's libertarians, Tea Party, MAHA, they stay the course. And I feel really gratified, and I hope other people do, that we are making real progress, that we are winning, and that we certainly need new strategies to reach people. New messengers, diverse messengers to reach people in every pocket of America. But I feel really positive that that we have the truth on our side, and the love for children and humanity and the earth and our brothers and sisters. And we can bring that to a public that is very, very hungry for that kind of messaging, and to eliminate the greediest people in the United States, who are really making it so much harder for the rest of us to have basic survival, pay for our families and our health, and afford when really catastrophic health issues come to bear, not just on us, not just on our children, but oftentimes many, many people in our families and many people in our communities. So thank you to Hart Research for all of this, and all of our partners in Take Down Toxics, and I'll turn it back over to you.
Thanks so much, Judy, and thanks so much for doing this in transit. I really appreciate it. And now I'll turn it over to Cindy Boyle from the National PFAS Contamination Coalition, which is another member of Take Down Toxics, for her thoughts and insights.
Thank you so much, Eve, and excellent remarks, Judy. I would reaffirm everything that you said, very thoughtful and very true. I found the Take Down Toxics work to be very informative and enlightening, and the Hart Research to be very useful, and I hope everybody on this webinar will find it to be as well. One of the priorities for me, and I, of course, represent National PFAS Contamination Coalition. I, like everybody in that group, is um, an innocent landowner impacted in one way or another, and in my case, health from PFAS contamination. And we do this every day, all day, it feels like, fighting the very difficult uphill battle around educating our communities about PFAS and toxic chemicals. So what was very important to me is that we figure out ways of messaging and communicating with people and audiences that we don't otherwise talk to on the regular, and that we're just have an opportunity to actually ask the direct questions to find out if what we think resonates in fact does. And I think we got some of those answers in this Hart Research and learned a lot because of it. What was most important to me was being able to identify the key phrases that actually resonate with folks, so that we had that reaffirmed and it wasn't just some assumptions. And then very encouraging was the fact that once we employed some communication, we could actually see an increase. I think it was an 8-point increase nationally on people's awareness and levels of concern. So that does tell us that we can move the needle. And, I and many other people who work on NPCC live in very diverse communities. Um, Maybe I should clarify, actually. We live in communities that are diverse across the country, but we live in communities potentially where, we're talking to audiences who are more conservative than most of the environmental audiences. And I think it's super important that we learn to have a dialogue with those folks, so that, because everybody deserves safe water, everybody deserves clean, safe food. And I think we have to get out of our silos sometimes and be able to just have an open dialogue. So I'm very grateful for the Heart Research, what we've learned from it. I look forward to being able to put it into practice in conversations and marketing messaging with Takedown Toxics and National PFAS Contamination Coalition. And I really thank everybody who's had a part in this. And I thank you, Eve, for helping to bring this to reality.
Thanks so much, Cindy and Judy and Rebecca and Jay. So we now have about 10 minutes for questions. And thank you. I think, Jay, you're the one who's been answering the questions so helpfully in real time. So that's wonderful. I think that let me see what hasn't been answered. So I think one question was from Renee Sharp. Were there any trends regarding age, ethnicity, or income that are worth noting?
I'm happy to answer that one unless you want to do it, Rebecca.
No, go for it, and I'll add. I've got some thoughts as well, but if you catch them.
Um, it was a great question, and that's why I wanted to do it live rather than answering it in the chat. But we did see younger voters, and by younger, we define them as under 35, a little bit more concerned, a little bit more both on a personal level and on a community level than voters in any of the older age cohorts. Oftentimes, women were more concerned than men and had higher levels of support as well. So younger women, kind of, if you cross those two, were among the most base audiences for this type of issue. The thing that surprised me more than anything, because it's so counter to virtually every other topic we work on, is that the more educated a voter was, the less likely they were to see toxics as a problem. It was actually those who had no more than a high school degree who had a slightly higher level of concern and higher level of support for regulation than or saw the more need, I should say, more need for regulation than do those with a college degree or a even a postgraduate degree. Again, this is so counter to every other issue, almost every other issue we work on, and particularly environmental and health issues, that it really took me aback a little bit.
I will say on that, I think that we've done qualitative and quantitative research on a very similar topic, not this project. But I think one of the things in that research that really was a hard nut to crack with more informed audiences was this belief that, while these things might be bad, they're so essential to our daily lives. And they're essential to the convenience of our daily lives, but they are also essential to like life-saving treatments and medical devices and those kinds of things. So that is a challenge area, I think, for the campaign.
So again, it's challenging to
And I
figure
say
out.
one thing in there,
Oh, good.
Eve.
Please, Jody. Thank you.
Yeah, thank you. I can't, I don't have the expertise in the polling that you have, so I can't, so this is just a theory. But when it comes to toxic chemicals, I would say that the people who have advanced degrees would tend to be making more money. They may have more access to healthy food. They may have better access to food. They may have access to places to live, housing, all of these things that come with more resources. Um, Also give you much more access for opportunities to treat disease or to escape pollution, whether it's holidays or wherever you live, to get, vaccinations and hospital visits to prevent diseases and et cetera, et cetera. And so it could be that on the particular issue of toxics, that the people who have the least amount of education formally through academies actually know the most about how toxic chemicals affect them directly and are the most motivated to make the policy changes that we're all also motivated to make.
Such an important point, Judy, and really well said. Thank you. So a quick question for the broader audience. While focusing on terms, you mentioned that toxic is the term that works the best. Would it be good to use the term environment less?
In what context?
Yeah. Do you want to offer context in which it might be better or worse to use the term environment? And I know that's a little bit of an extrapolation, and so if you're not comfortable answering it, feel free to.
No, I think that, I think that the highest level of concern, I just don't understand what the context of the question is, but that the highest, is the question related to, do we talk about environmental toxins? Is that, do you think what?
I think that probably is. Yes. So,
Yeah.
it's like, that we should have, that maybe it's more about like pollution in the environment.
Yes.
And we shouldn't really
Yes.
focus about pollution in the environment. We should be focusing on toxic toxic exposures or some other way of
I think that it's a fair question, and I think that we referred, the entire survey was about chemicals, pesticides, and those kinds of things. And so at the end of the day, they weren't thinking about environmental toxins, right? We didn't frame it that way throughout the survey. We did not frame it as toxic throughout the survey, they were given those words. But I think that the thing that connects most easily with voters is when we talk about the health concerns. And I don't think voters, and Jay, you might feel differently than me about this based on your climate work, but I don't think voters think necessarily of environmental toxins. I don't know that many voters make the direct tie to the health concerns. So I would, and
I do think that was the upshot of the question being asked. That's how I interpreted it. That if we talk about harm to the environment versus harm to health, if those are and someone else in the Bobby Wilding sort of said health frame versus environmental harm. I do think if that is the trade-off, then we are on such stronger ground with the with the health
Health.
frame than with
Yeah.
environmental harm.
Yeah.
Loads, like not even close.
If I could comment that just, that stands to reason, right? Because the environmental reference is arm's length. So in your day-to-day lived experience, yes, you're aware of the environment around you. I'm talking about when I say you, the average person, but you think of it in an entirely different context than you do when you're taking a drink of water, eating some food, and then seeing those direct health impacts. So stands to reason.
Yeah. Yeah. And then I think the next question I was going to flag that kind of builds on this and also dovetails with, what I think was such an important point in this polling about how people have this really strong concern, but it's more at a national level, and they really are less worried that the specific locality where they live and work is a place that's resulting in toxic exposures to them. So the question is, I'm trying to square the comments about high concern about toxics in food nationally, but not in local communities. Since a lot of products have a national market, could that account for the discrepancy? Meaning that people don't think that their locality has a higher concern than national exposures because it's a national market.
I think we want to make sure we clarify. A lot of these questions were similar, so it's easy to confuse them and conflate them. We did not ask specifically about food nationally versus food locally. We asked about just the problem of harmful chemicals nationally versus the problem of harmful chemicals and pesticides and plastics locally. And I think it's a function of people understand or believe that chemicals are bad kind of writ large, and are more apt to think that there are problems somewhere else and just not in my own community. It's not something they can see or feel necessarily. We even see this. I keep coming back to air pollution, and I apologize for those who say, those who have said it's not the same thing. I get it. I understand. But people tend to think that air pollution is a big problem somewhere else, not in their own community, and that it's kind of almost no matter where they live. So I think it's just it's a function of an aptitude people have to think that to really like where they live and think things are fine where they live, and to think that people elsewhere are having problems.
If I could just add one other thing to what Jay said, which I think is spot on. People feel like they have more control over their own space and environment, whether that's their home or their
That too.
community. And we did ask people, compared to other things you're concerned about, how high a priority is limiting exposure to chemicals, pesticides, and plastics in your life, in your family's life. 6 in 10 voters told us it's a high priority for them. So they think they're doing it. And then we asked a follow-up open-ended question and said, well, what are you doing to the people that said it's a high priority? And they said the things that you would think they would say. They say, well, I check the ingredients on my food and I limit my kids' exposure to plastics, and we don't drink bottled water. And folks feel like they're controlling things, I think. And then to Jay's point, I just think people don't think that the water they drink, which is why that factoid I mentioned is so compelling to people. It's like, good Lord, am I in that percentage of people whose community has chemicals in its water? If half of, households do. So I think there's that element to it as well.
Great. Well, unfortunately, we're actually a minute over time. So many thanks to Rebecca and Jay and Judy and Cindy, and again, the Broadreach Foundation for the support for all of this work. So happy that this was interesting to so many of you, and look forward to continuing to work together. Have a great evening.